Hello guys, today we are going to study ESIC Nursing Officer previous year question paper 26, 26 Feb 2019. Question number 1. Gestational diabetes increase risk for the following except. Option second, small fardate fetus. Question number 2. The nurse is assigned to a patient who has a bacterial pneumonia and is under droplet precaution. Which personal protective equipment will her wear to deliver meal tray? Option second, only mask is needed. Question number 3. Artificially acquired immunity is maintained by. Option number 3, immunization with antibody response is correct. Question number 4, which of the following would not promote trust in the nurse-patient relationship? Option number 4, examining wound without providing privacy. Question number 5, refrigerated breast milk should not be used if it is beyond 48 hours. In the liver, bacteria that found their way into portal circulation is destroyed by Kupffer cells. The three features of community: location, population, and social system. Medical asepsis differ from surgical in that it is aimed at preventing transmission of microorganisms. Cerclage is done for patient with incompetent cervix. The most significant characteristics experienced by a patient with depression is depressed mood and loss of pleasure or interest. The CSF is secreted by choroid plexus. The inflammatory exudative phase of wound healing will last for 1 to 4 days. Principles of ethical practice include the following except maleficence. The person who becomes short of breath with little exertion, such as eating a meal, has what kind of respiratory condition? Dyspnea. Behavioral clue of impending suicide are as follows except. Option number second, hypervigilance and exaggerated startle response is correct. Vital statistics include the following except. Education rate. Which of the following is most abundant type of blood cell? Erythrocytes. In traditional source-oriented narrative type of charting is characterized by all of the following form except the laboratory test. The main cause of genital wart is human papilloma virus. The normal level of sodium in plasma is 135 to 143 m equivalent per liter. Role of community nurse in school health program except to provide immunization to the children. Phototherapy is indicated for children with hyperbilirubinemia. Para is defined as number of past pregnancies done beyond period of viability. In rheumatoid arthritis, during the acute phase of the value which are significant are ESR and C reactive protein elevation. Homan's sign is used to assess deep vein thrombosis. A significant predictor of fetal well-being is fetal heart rate at 120 to 160 beats per minute. Example of autosomal recessive inheritance. Option second, cystic fibrosis. Complete dilation of cervix to birth of a baby is staged as stage second of labor. The major determinant of health except screening for disease. The characteristics of lochia rubra is bloody with fleshy odor. The key instruction to be given to the patient and the caregiver with epilepsy is as follows. Accept, take shower, take shower in bathtub. Potential adverse effects of surgery and anesthesia are as follows. Accept, dehydration and electrolyte imbalance. The brain region which is responsible for coordination of voluntary muscular movement, posture and balance. Cerebral. In what way could hepatitis A virus be spread if one of the kitchen employee is in the reservoir? Oral fecal route through his hand. Eclampsia is characterized by the following except mild facial edema. When dangling the patient at the bedside, monitor for orthostatic hypotension and dizziness. The following are presenting symptoms of patient with catatonic schizophrenia except disorganized behavior and speech. The following are the important preoperative nursing care for a patient with benign prostatic hypertrophy except hormonal therapy. One cardiac cycle completes in 0.8 seconds. Why it is important for healthcare provider to monitor the growth and development of the children. Early detection of potential problem lead to earlier care and treatment. Approach to health is that acknowledge and respect the interaction of a person, mind, body and spirit within the environment is termed as holistic health model. The extracellular fluid include the following except fluid with the cells. Apgar score is considered excellent if the score is 7 to 10. In inborn error of metabolism are following except Turner's syndrome. Cardiogenic shock is precipitated by myocardial infarction. The main sign of symptom noticed in patient with achalasis dysphagia. A clinical sign that a patient is close death would be period of apnea and irregular respirations. The amount of air passing into and out of the lung during each cycle of breathing is referred as tidal volume. Philosophy of primary healthcare are as following except primary prevention. Nurses are nursing process as a method of planning, organizing and delivering patient care. Tumor within sella tunica and small adenomas of the pituitary gland can be removed through transspinal approach. All elderly tend to be more susceptible to infection because of a decline in immune function. The patient with appendicitis usually exhibit the following clinical manifestations: rebound tenderness at the MC Burney's point. Bipolar disorder are treated with the following medication except amphetamine. Wearing seat belt, safety helmet and other safety equipments are example for primary health promotion behavior. The drug of choice to treat bulimia nervosa is antidepressant, for example SSRI. The main clinical manifestation of pulmonary edema are as follows except hypotension. The major nutrient involved in fluid balance are potassium and sodium. The commonest drug which is administered during an anaphylactic reaction injection epinephrine. The cleft palate usually repaired 6 to 18 months, the size of which part of eye contribute to the controlling the amount of light entering the eye pupil. A ganglionic disease of the intestinal tract which causes inadequate motility is termed as Hirschsprung disease. The most common method of microorganism transfer from one person to another is the hospital setting is prevented by washing hand thoroughly and frequently. Accumulation of endolymph causing detention and increased pressure within the membranous labyrinth, within destruction of sensory cell in the ampulla and cochlea is Meniere's disease. The complication for ventricular septal defect are as follows, except cerebral palsy. Preterm labor is when it occurs between 20 to 37 weeks of gestation. Rh negative mother should receive globulin. Rho immune. Positive definite sign of pregnancy. Visualization of fetus by ultrasound. When considering the principle of growth and development, remember that although development occurs in an orderly sequence, the rate may vary between individuals. Protective devices are applied snugly. Which of the following findings would you be concerned about? Pallor of the nail beds. Bulging sac-like lesion filled with spinal fluid and spinal cord element is myelomeningeal. The elderly individual is at greater risk for dehydration than the middle-aged adult because compensatory mechanisms work less efficiently. Beds on the unit have rapidly filled and the patient with bacterial pneumonia is about have a roommate. The roommate is post-surgical patient without an infection. The nurse would notify the admitting office that he new patient cannot be housed with a patient under droplet pneumonia. Current jelly-like stool containing blood and mucus among 3-month to 3-year-old child is suspected to have intussusception. Patient complains of pain and has redness with swelling at site of IV. The nurse must stop infusion and remove IV cannula. Alcohol withdrawal symptoms are as follows, except euphoria. Responses to avoid in therapeutic communication are as follows, except reflecting and clarifying. Which of the following is not a typical difference factor between benign and malignant tumor? Size of the tumor. Montauk's test is significantly positive when the erythema measure 15 mm or greater. To encourage an infant's cognitive and psychosocial development, parent and other caregivers should give loving, consistent care, including playing. Health maintenance program for older people in the community are as follows, except palliative care. Fast labor manifestation are as follows. Cervix progressively effaced and dilated. The key dietary advice given for patient with gastroesophageal reflux is to avoid caffeine, tobacco, beer, milk and carbonated beverage. Compression of facial nerve in the temporal bone which lead to Bell's palsy. Considering the chain of infection, a reservoir might be a contaminated water supply. The level of care is oriented toward the promotion and maintenance of health and prevention of community disease, the management of common episodic disease, and the monitoring of stable or chronic condition. Option 4 primary care level. Standard precaution require the use of protective eyewear when there is a danger of body fluid splashing. Secondary prevention is early detection of disease and prompt treatment. In erection theory, adolescents develop a sense of identity. Repetitive, uncontrollable thought and acts is termed as obsessive compulsive disorder. The bacteria that retain the stain in Graham's method of staining is a gram-positive bacteria. The reflex action of the two are indicative of abnormality in the motor control pathway leading from cerebral cortex is Babinski reflex. Reye's syndrome is associated with use of aspirin with viral illness. The classical substance that increase the sensitivity of pain receptor by enhancing the pain-provoking effect of bradykinin is prostaglandins. When a pulse rate is irregular, it is best to count the apical pulse for a full minute. When assessing physical development of the 5-year-old, you would find it abnormal if he needed to go up a stairway one step at a time. To properly stage a pressure ulcer, a scar must be removed. HbA1c indicate post serum glucose level over previous 3-month period. The patient who has an appointment for a pap smear should have been instructed not to touch or use vaginal medication before the test. Progressive thinning and shortening of cervix is termed as effacement. In which country does the Irrawaddy River flow? Myanmar. Who is the author of Wide Angle? Anil Kumbal. In which state is Chilka Lake located? Odisha. What is the capital of Sweden? Stockholm. Which country hosted 2018 FIFA World Cup? Russia. Choose the one from the given alternatives which is related to the following equation. Option 4 is correct. What will be the next number in the given series? Option 3, 162 is correct. Read the data carefully and answer the question. The following Venn diagram shows information about number of persons who like a specific type of tea flavor manufactured by a company XYZXYX. How many people like the taste of only 2 types of tea? Option first 38 is correct. Three of given alternative follow a certain relation. Find the instrument which does not belong to the group. Option 4 conga. Study the following figure carefully and identify from alternatives the one in which the figure given below is embedded. Rotation is allowed. Option first is correct. If L represent plus M represent minus n represent into and p represent. Then what will be the result of following expression? Option third is correct. In a group of dog and chickens, the number of legs is 14 more than twice the number of heads. Find the number of dog. Option first is correct. Read the following situation carefully and choose the appropriate response to the situation. Status: you are suffering from diabetes and obesity. At a wedding party, your colleague offered you two more sweets. That would you do? Option first: with a pleasant smile, you refuse to take that offer and say, "My stomach is full." A transparent sheet consists of pattern as shown in the following figure. What will the pattern look like when transparent sheet is folded on dotted line? Read the given statement and conclusion carefully and choose which of the conclusion logically follow from the statement. Option 4. Neither one nor two. If the height of right circular cylinder is 14 cm and the area of its curved surface is 704 square centimeter, then its volume will be 2816 centimeter thrice. The total amount invested by three persons, B and C, is 1219 rupee, in which of the share A is 3/2 times that of B. That of B is 7/4 times that of C. So the square of C is option 4, 240. A ladder 10 meter long reaches a window located 8 m above the ground. Then the distance of foot of the ladder from the base of the wall is 6 meter. In terms of volume V, the curved surface area of a right circular cylinder of base radius r will be 2V by r. Which is a more appropriate advantage of a histogram over a polygon. Each rectangle represents a clearly distinct class in the distribution. If the length of diagonal of a square is 25 centimeter, then the parameter of the square is option 4 is correct. In this, option 3 is correct. There are two digits in a number. The digit in the 10 place 1 more than the digit in the unit place. The sum of digit is 161. So the number is option 4. Option 1, 454. The sides of triangle are 7 centimeter, 5 centimeter, 3 centimeter. So the greatest angle of the triangle is option 4 is correct. Two poles of equal height are standing facing each other on the side of road 40-meter wide. From a point on the road between them, the angle of elevation of the top of pole are 60 degree and 30 respectively. So the height of the pole is option second is correct.